If you don't mind, would you share with me a little bit about your background and what motivated you to get involved with the company or to create the company?
Okay, so I have a 30-year background in medical imaging and healthcare IT. And I've worked with companies such as Siemens Healthcare and GE Healthcare to commercialize new technologies in those areas. And, was really wanted to get more involved on the entrepreneur, the innovative side in terms of, picking a new technology out of academia and bringing it to market. And that's when I got in touch with the people at the Penn Center for Innovation. And they had formed QRS with two of their professors in the Department of Radiology. And they asked me to join as the entrepreneurial leader in order to develop and commercialize the technology. So that's how I got involved with QRS.
What problem or problems does your company address?
So in general, we address the problem of helping oncologists make better, analyze medical images to make better cancer treatment decisions. There's a lot of information that's available in images, and only a portion of it is actually being used today. But the specific problem that we targeted was helping to reduce side effects for cancer patients undergoing radiation therapy. And there's an important step in treatment planning where a physician will outline, or as they say, contour, the so-called sensitive organs that should not be exposed to radiation. They do it manually, and it's very inaccurate and it's very inconsistent. So we're targeting that problem, automating that process for them in order to do it more accurately, consistently, and efficiently. And that will help to reduce the side effects for those patients.
So who experiences this problem? And can you give me a story or an example of somebody?
So maybe it's kind of a hypothetical somebody. It was someone who I know that had head and neck cancer, right? And in head and neck cancer, you have a lot of sensitive organs that are in the neck. It's a very, very small area and you're shooting radiation in there. And for example, if you tend to irradiate the esophagus or the glands, it makes it difficult for a patient to swallow. And if a patient's not able to swallow, they can't eat, and then they'll be malnourished and they'll wind up going to the emergency room or to the hospital, right? So, and that happens quite frequently. About 30% of the time, a cancer patient undergoing radiation treatment will have to go to the ED or for an unwanted inpatient admission. So they're the kind of patients that we're helping by helping to avoid those side effects.
Interesting. Can you tell me your solution as if you were speaking to a classroom of freshmen in high school?
Right. So the best way I like to describe our solution is we are facial recognition for medical images. So you give our solution a picture, an image from an MRI or a CT, and we will analyze that. We will first of all recognize what body region we're looking at. Are we looking at the head and neck? Are we looking at the thorax, the abdomen, the pelvis? We'll recognize the body region. Once we recognize the body region, we go in and we recognize all of the anatomical structures that are relevant. So if you give us, for example, a CT of the chest, we'll recognize the lungs and the heart and the brachial plexus and the vena cava. So once we then, and that's kind of like tagging, like much like Facebook would tag a photo of you and your friends, right? And once we do that, then we're able to analyze those structures. And in this case, we're outlining them, for use in treatment planning.
Great. Can you give me a use case, how your solution impacts a person having the problem?
Well, I gave the use case. Are you talking about a use case for a patient or more up for the physician?
Either way, is it maybe share what it would be like for a physician to be able to utilize this technology and what it would be like for a patient.
So let me talk about the physician perspective, right? Because it's important to understand why doing it manually is so difficult. And let me go back to my example of a patient with head and neck cancer. And when that patient goes for radiation treatment, A CT exam will be done. It's called a CT simulation. And that data set, those images will be passed to the physician. So the physician will have, say, 80 to 100 slices or 80 to 100 images looking at the head and neck, and they're expected to outline or contour, 12 to 15 structures. So they sit there with their mouse, with their computer mouse in front of a screen, and on each slice, they laboriously outline that structure. And they do that for the 80 to 100 that I mentioned. So this process it's very tedious. It could take an hour, maybe even more than an hour. It's not fun to sit there and do that. And, and it's because it's so tedious and time consuming, it's very inaccurate. But there's another important piece of that. So when a patient goes for treatment, this CT simulation I mentioned is done before the start of treatment, okay? And the plan is created. Now, a patient, the course of treatment could be 6 to 8 weeks, right? And during that 6 to 8 weeks, the anatomy changes. I mean, hopefully the tumor is getting smaller, but the patient might also lose weight. So if you're in week 3, all of the anatomical structures where you thought they were in week 1, they're probably not in the same place anymore, right? So there's a need to do replanning to make sure that the radiation is going to the tumor and not to the healthy tissue. And when the process that I described before is so cumbersome and so tedious and so time consuming, it impedes them being able to do the replanning. And by us making that process more efficient, not only is it accurate from the start, but we enable a physician to replan during the course of treatment to address those anatomical changes that I mentioned.
So I want to make sure that I understand this. Is this something that a patient has a CAT scan, and then your technology takes that CAT scan and maps it? I'm not even sure really how to ask this. I guess what I'm trying to get my head around is, will they have to have ongoing screening in order to utilize and benefit from what you're mapping?
I wouldn't say screening, but yes, there will be multiple CAT scans. So yes, a patient will have a CAT scan at the beginning of treatment. We'll do the automatic analysis, recognizing the structures that need to be protected and outlined, and then we'll hand that to the physician. And then let's say week 3 or 4 of the treatment, right? The physician may determine that the anatomy's changed. Another CAT scan will be performed. And then again, we'll do the automated analysis of that and send it to the physician.
Great. And the automated analysis, is this a software program? Is it actually a physical program? What is it actually?
It's very much, again, it's very much software where it moves from the images move from the CAT scanner to our system to do the analysis, and we pass them on to the treatment planning system. So it's a software only solution.
What are the biggest challenges right now?
Fundraising it's always a challenge. As I mentioned,
I'll tell you, that's the answer I always get.
Yeah. I mean, we were very fortunate, and we raised $2.5 million from National Cancer Institute that supported our product development and our clinical evaluation. Now, we have to be able to bring in our own funds in order to do the product launch. I mean, that'll be one. And I think the second thing that'll be a challenge for us is how we bring across the benefits to the radiation therapy centers or the radiation oncology departments, especially given COVID-19. I mean, before we would go to trade shows or conferences and we would meet people there, or we would be able to set up appointments and go into hospitals, but none of that's possible today, right? So we're going to need to be very creative in terms of using digital media and ways of getting our message out and bringing across our benefits.
Do you have anything else that you'd like to share that I haven't asked?
Yeah, I just wanted to also bring up that, we recently, a few months ago, got a second grant from the National Cancer Institute to take our technology and expand it into the area of looking at treatment response. So what we're looking at is, instead of just using CT images, using PET-CT images, which actually do a better job of showing disease tissue, and then analyzing that disease tissue so we can tell the physician, is the patient responding to treatment, yes or no? And this kind of early warning, in terms of patient response, will help them to better direct treatment. So we're really excited about that second application, and that's something that we would hope to be getting into market in 2022.
Thank you for watching the Lowdown on Cancer presented by the Cancer Fund. To learn more about what's coming in future episodes, visit us at www.cancerfund.com. While you're there, check out past episodes and be sure to click Join Us to become a member of the Cancer Fund community. As a member of the community, you'll receive early access to new interviews as well as other announcements. Make sure to connect to all of our social media channels so you don't miss a thing. In addition to getting early access to new episodes of the Lowdown on Cancer, Cancer Fund members play a critical role in driving cancer innovation forward so that one day we can more than hope. We can actually beat cancer. Thank you for joining us on this journey.